Should pregnant or breastfeeding women get either of the COVID-19 vaccines? It's a question that's been floating around now that people have started getting vaccinated. Today, I spoke with an infectious disease doctor who gives some insight on what the studies say.
In the Pfizer vaccine study, Dr. Brian York says pregnant or breastfeeding women were excluded. During the study, 23 women became pregnant and 9 dropped out after the first dose.
The rest of them went on and received the full course of vaccination, and they'll be followed through their pregnancy to see how those pregnancies turn out. But we don't have any information other than that they are going to follow those patients.
In the Moderna trials, women were tested for pregnancy before the first dose, and if they became pregnant, they had to stop. Now Pfizer is doing further research.
Some research in animals with their vaccine, but is not yet doing any human pregnancy trials.
The CDC says there isn't data on the effects of COVID-19 vaccines in pregnant women. But Dr. York explains experts do know how mRNA works.
Messenger RNA does not enter the nucleus of our cells where our DNA is, so it shouldn't interact with our DNA at all. And that is something that has led experts to believe that the likelihood of the messenger RNA causing any damage to the genes in a developing baby in utero is very low.
Dr. York says pregnant women are at an increased risk for COVID-19. CDC studies show they're more likely to end up in a hospital for treatment, outweighing the already low risk of the vaccine.
But they suggest that be a decision that's made in consultation with their primary care provider or their obstetrician based on how the vaccine works and what we know about physiology of human development. It's felt that it is more likely than not going to be proven safe.
Same goes for breastfeeding or lactating women. The CDC says there isn't research to show that it's unsafe because of how mRNA vaccines work. Again, Dr. York says it's a decision a woman should make in consultation with her care provider.